Thank you so much for coming to our show on South Asian health. I really appreciate it. It's a real pleasure to have Congressman Jayapal with us here today. And I'll just start by asking a few questions here as part of our interview. First of all, can you tell us about yourself and your background and what led you to propose the South Asian Heart Health Awareness Act?
Yes, well, it's great to be with you, and it's just wonderful to see this kind of education within our South Asian American community. I am Pramila Jayapal. I represent Washington's 7th Congressional District, which is in the state of Washington, which is essentially the Seattle and surrounding areas. And I am the first South Asian American woman ever elected to the House of Representatives. And I'm also an immigrant. I grew up in India. I was born in India, in South India. I grew up in India and Indonesia and
Oh,
Singapore.
wow.
And I came to the United States when I was 16 by myself to go to college. My parents still live in India, so I'm still very connected. And, in terms of, I've been in Congress since 2017. I got elected in 2016. And that was actually my first term. My legislative director, who's also South Asian American, his mom died very suddenly of a heart attack. And
Oh, wow.
it led us to research this. And I had no idea that South Asian Americans are 4 times more likely to develop heart disease than the general population, or any of the statistics around this issue. And so that's kind of what led me into proposing this act and getting it passed in the House, and very excited to try and
congratulations
get it
on
through.
that. That's a really huge. I'm so excited. And of course, this will be such a great thing for everyone.
Yes, absolutely. I just think that there's so many people who don't know that, a lot of the statistics that you go over in your show as well, and how you can prevent heart disease and how you can have the tools to be healthier, to live healthier lives. I think if you asked any South Asian American, and I think I'm representative of this, I didn't know any of this until I started looking into it, but 2/3 of South Asian Americans are at risk of intermediate heart disease over the next decade. And we have got to do something to stop that. And we've got to make sure that, when we're looking at these statistics, that we understand that while we may think we have healthy diets,
Right.
in fact, there are different factors for South Asian Americans that we need to understand.
Totally. Yeah, we have a unique there's differences in South Asians that definitely need to be accounted for by physicians. And no, I agree with you. No, this is wonderful. So I was going to ask you, you had to relaunch the campaign for the bill in 2021. What led to that? What inspired you to do that?
Well, unfortunately, the way Congress works is it's slow, and you have to get a bill through in both chambers, both the House and the Senate. And so last term, we were able to get it passed in the House, but not in the Senate. And so this term, we got it passed again, and we had an incredible bipartisan vote this time.
Wow.
Almost 24 Republicans also voted to pass the bill. My co-lead on the bill is a congressman named Congressman from South Carolina, Joe Wilson. And so he was also very helpful to me. And I think that we know that there's bipartisan support for this bill. So now we just need to pass it in the Senate. And the minute we pass it in the Senate, I know that President Biden will sign it. Speaker Nancy Pelosi has been super helpful as well.
Oh, that's huge. Let me ask you, what do you think the chances are in the timeline in the Senate in terms of getting it passed?
Well, that's where we could use people calling their senators and saying how important this bill is, because we only have through the end of this term, which is the end of December, for the Senate to pass it. Otherwise, we will have to pass it again in the House next term. So
wow,
Right. So Senator Booker is the lead sponsor in the Senate, and
Okay, Cory Booker.
exactly, Cory Booker from New Jersey. And
Great.
so, call and tell him, thank you for leading it, but also let's try and get it moving quickly. I know he cares a lot about this issue, so it'll be nice for him to hear from people. And then we've got to get we need to get Senator Schumer also to put it up for a vote. Everything takes time. And so
Mhm.
that's some of what we're running up against, but it's why it's so important that people weigh in now quickly, so that we can try to get it passed in the Senate.
Um, and I was going to ask if you could also talk about, if it does pass, what is the plan? I mean, how will that bring hope to what's happening to South Asians to receive better health care to address these issues?
Yes, well, the bill does a couple of things. It provides promotion grants for educating our South Asian American community about heart disease. And so it will allow people to just, have proactive outreach, so that our community understands what the risks are and can really be more mindful and take care of their health,
Hmm.
and know what questions to ask. It also supports overall research on heart disease. And so it might help not just South Asian Americans, but everyone in coming up, hopefully, with a new drug that might be helpful, for example.
Huh.
And it also has a clearinghouse. It establishes a clearinghouse at the NIH, about the research that's out there, so that it's easy for people to search and, again, have tools that help educate them. So I think on every one of these levels, and let's be clear that some of what we're finding in the South Asian American community also applies to other communities, right? So this isn't
Oh
just
yeah.
helping our community, it's helping
Hmm.
everybody that has heart disease.
Yep. Okay. Um, and how will it help? This is a question from one of our viewers. How would it help non-citizen South Asians?
Well, it helps all South Asians here in the United States, whether you're a citizen or not, because
Okay, great.
obviously our healthcare is for for everybody. So I think that's very clear, and also I think it'll help around the world. I mean, we're getting information from South Asia about heart disease, diabetes in South Asia that's relevant to South Asians here in the United States. There's a lot that we have to do to provide healthcare for everybody, and that's something
Hmm.
else I'm working on. I'm the lead sponsor of the Medicare for All bill because I really believe healthcare is a human right, and we're trying to move forward on that too. But this bill will help South Asians, whether you're a citizen, whether you're a resident, whether you're living in India, or whether you're living in the United States.
Yeah, your efforts are so admirable. Thank you. I wanted to ask you, if it doesn't pass, do you have a plan B? Uh,
We're gonna pass it. I mean, we're gonna sometimes you have to try multiple times, because each Congress is different. Democrats have control of the House and the Senate, which is part of the reason we were able to pass it
yeah.
last session and this session. I hope we control the House again, and the Senate again next session, but I'm hopeful that we can still pass it this year. We're still working very hard on that. So plan B is just go at it again, and I believe we will get it passed, but sometimes these take longer than we would like. We're so close though, and if we could
Mhm.
just get, the Senate to put it up and some bipartisan senators, just like we got bipartisan support in the House, I believe we can do it in the Senate.
Awesome. Wow, that's great. So I really everyone applauds you on your great efforts, and it's such a unique thing that you're doing this for the South Asian and hopefully other similarly affected ethnic group communities. I think it's great, and I really appreciate your time, and I think those are basically the questions that I had. Um,
Great. Well, thank
and
you
thanks
so
so
much.
much. And thank you everyone else for joining us on